Well, hello, welcome everyone. Welcome. Just going to pin your panelists to your screen so you'll be able to have a nice view of that. Oh, did I just pin myself? I apologize. Pinning the wrong people here. Awesome. Thank you for your patience, everyone. So I'm thinking we'll get started in about half a minute or so. In the meantime, grab a cup of coffee, tea, get settled. We have a really interesting conversation tonight. My name is Andrea. I'm the associate for our webinars program. I'll be your host for tonight, alongside Katherine and Jason, who will be introducing themselves momentarily. Before we begin, I do have a couple of housekeeping rules, so to speak. First and foremost, this webinar is recorded, which means you will receive a recording in your inbox within a day or two. Please feel free to review it, ask questions. I should say respond back with any questions you may have, and share it with your network. Share it with anyone you think may be interested in learning a little bit more about how to prepare for the MMI. Alternatively, we have, I apologize, sounds like I'm losing my voice tonight. We're looking at running this webinar for about 45 minutes. So half an hour of conversation, and then we love to leave a 15-minute window or so towards the end for a Q&A with our wonderful panelists tonight. So please feel free to get those questions in the chat throughout the course of the webinar or even towards the end. But yes, that is definitely your time to get those questions answered, whether it's about MMI, whether it's about the application process. We're here to support you. So what does it look like tonight? What kind of discussions are we having? So we'll be speaking about the ins and outs of the MMI format and what to expect. We'll speak on the effective strategies for tackling different types of MMI stations. We'll be speaking about time management techniques, as well as how to highlight your skills, experiences, and passions for a career in medicine. Now, before I pass it over to our panelists, just a quick introduction to who Inspira is. Whether this is your first time with us or you've been here before, we're super excited to have you. And sort of share with you a little bit about what we offer and who we are and really what makes us the leading experts within the space. So Inspira Advantage is a globally recognized admissions consulting firm and test prep firm with 15 years of experience. We specialize in guiding students through the complex and competitive process of applying to different graduate schools, especially in the healthcare field, whether that's medicine, residency, dental, veterinary, physician's assistants, as well as nursing programs. We have a 94% acceptance rate, so we maximize an applicant's chances of getting into the world's most competitive programs. We firmly believe in starting the candidacy development process as early as possible. For college freshmen, we offer pre-advising and profile development. Together, we build a timeline and plan for the years leading up to applying and help walk the students through every step of the process. We start with a complete academic advising, including course selection and GPA strategy. Next, we help students get involved in the right experiences in order to help differentiate their profile and become a top applicant. This includes finding and applying to research engagements, shadowing opportunities, clinical, non-clinical volunteering, student clubs, organizations, extracurriculars, leaderships, experiences, as well as clinical experiences. Our goal is to help students gain a strong foundation and understand what admissions are looking for while building a profile that sets them apart from other applicants. While our counselors support students in building their profiles, our team of tutors works closely with them to get personalized one-on-one tutoring. Students take an official diagnostic test before starting, so tutors can assess their strengths and areas of development. This creates a customized study plan structure for the days, weeks, and months ahead. We tailor our approach to each student's unique needs and schedule, providing the right assessments and lessons as they become familiar with the test content, strategies, and format. Intern tests monitor and track progress, allowing us to modify study plans and build an upward trend leading towards the official test date. For MCAT students, see an average of 15-point increase for 45 plus hours of tutoring. Our 60-hour programs include a score guarantee of 515 for the MCAT. Once we've helped shape an outstanding candidate, we continue working with them to create the perfect application. Our all-inclusive application program provides students with unlimited support for the entire application cycle. Our program starts with detailed profile analysis, diving deep into the student's stats and experiences. This foundation helps create a unique story and application narrative and also helps guide the creation of a well-balanced list of reach, target, and safety schools. Our admissions counselors, who are also essay writing experts, will brainstorm, outline, and edit until your personal statements and supplemental essays are perfect. These essays showcase the best aspects of our students, connecting the life journeys with each school they're applying to. Whether it's the main application or scholarship essays, we offer unlimited edits. Overall, our goal is to build the most competitive candidate and application. We use every tool in our skill set to ensure the products we create with our students stand out from the rest of the pack. With that being said, I know you're not here to listen to me speak all night. I'm going to pass it over to your wonderful panelists here who will introduce themselves and continue the conversation.
Hi, good evening, everyone. Thanks for joining. Thanks for having me. My name is Katie. I'm one of the PGY4 plastic surgery residents at University of Wisconsin. I originally went to Virginia Commonwealth University School of Medicine. So I'm happy to chat with you all about MMI interviews tonight.
And hi, everyone. I'm Dr. Jason Gomez. I was a dual degree candidate at Stanford, where I did both my MD and MBA, while there served on the admissions committee and did several MMI interviews during my 5 years there. So excited to share some pro tips with you today.
Awesome. So I can start just as kind of like a brief overview of what MMI is and why it is a unique kind of interview format. So this is a format in which, instead of perhaps the stereotypical interview format in which you're being interviewed by one or two interviewers, this is a format in which there are multiple stations, and each station really tests some component or multiple components of problem solving, communication, empathy, active listening, teamwork, things along those lines. Often there are scenarios in which you either have role play, in which you walk into a situation where there is a kind of like actor patient for a specific situation that you're kind of made privy to just moments before you walk in, or there are ethical dilemmas that your interviewer will kind of be present for you to walk through. There can also be task-based stations in which you are sometimes working with another interviewee or sometimes working by yourself to complete a task or a puzzle that requires usually teamwork, communication, things like that. And it's important to realize that this is a little different than other interview formats in that the interviewer is really interested in how you think and how you communicate, not just necessarily what you think and what you communicate. So that is a pivotal component of this. And then the nice thing I think about this format is that each station is independent. So the reviewer or the interviewer that saw you at this station will not necessarily immediately be able to communicate with the next. And so if you have a station that is perhaps not your best performance, it's a very easy format to kind of take a breath and reset before your next and have a better performance next time.
In terms of the types of, MMI stations that you'll encounter, two of them will include some sort of ethical dilemma. And so this will be a balance between some sort of personal moral with professional ethics. And it's focused on your reasoning. Can you think through the pros and cons of a situation? Can you think through different perspectives and not just the conclusion that you end up going with? And then, of course, there will be some role-playing scenarios where you can interact with actors who are portraying standardized patients, potential colleagues, or others, including sometimes your fellow interviewees. And it's important to stay calm, show empathy, and to actively listen and to demonstrate those skills in both of these scenarios.
Diving a little bit more into other types of MMI stations you may encounter. As Jason mentioned, some of these stations will be collaborative tasks. I've seen multiple instances in which, for example, one interviewee is drawing a shape, some abstract shape that they are not aware of, and another interviewee is in the same room but separated, communicating how to draw that shape. And really, there is no necessary interest in exactly if your shape is perfect or correct. It's actually just there to see how you communicate with others and how you problem solve. So collaborative tasks are popular among MMI formats, and we'll talk a little bit more about that later. Other options include data interpretation. This is, I would say, a more rare type of scenario, but you certainly could see it, in which they give you kind of, say, like a article from a journal, for example, and they ask you how to interpret this data, or what are these statistics kind of mean. And it's not really a knowledge thing. It's just like a logic and how comfortable are you interpreting like medical type of data.
So I'm just quickly popping back in before we continue. I want to see if there's any kind of questions in the chat thus far. I don't see anything right now, but again, please don't hesitate. Katie and Jason are, as you can tell, incredible at what they do. They have a ton of knowledge, so we want to make sure that you maximize this opportunity to get your questions answered. So definitely use the chat. And Katie, Jason, I'll give it back to you.
In terms of how you can approach the ethical dilemmas, it will always be some sort of tough decision that you have to make. And so it's important to, one, identify key stakeholders, who's involved in the ethical dilemma, and what is the conflicting interest. It's also important to stay neutral, avoid jumping to any conclusions, and explain your thought process clearly, and to consider all perspectives. So you really want to show that you are taking on multiple viewpoints, that you understand pros and cons to each of those viewpoints, and could make an argument for kind of each possible stance in the ethical dilemma. Always prioritize what's best for the patient, professionalism in any medical context, and of course, when in doubt, following the law, etc., is always critical for these ethical dilemmas. There's no right answer necessarily. Again, what they're really trying to assess here is, how can you reason through this issue? They're evaluating you on, your integrity, how you communicate, can you take on different perspectives, etc., because in medicine, you're going to be put in a lot of ethical dilemmas.
Absolutely. Moving on to the next, kind of diving a little bit more in detail here to the next type of station you may see is this role play station. I find these can be pretty challenging. They're usually emotionally driven stations that can be a little uncomfortable, certainly to walk in, and probably are situations you've not spent a lot of time in as a student or pre-medical student or undergraduate, whatever you may be. But it really can be a place that you shine. And so really this is a place where we want to demonstrate strong interpersonal and communication skills. So it's important that you stay present in the scene and treat the actor as if they are truly like the patient or whoever it is you're supposed to be interacting with. That can be a little bit challenging at times. You walk in and you're like, it's a little awkward and uncomfortable to pretend like you're my pediatric patient or something like that. But you just kind of got to lean into it and go with it. They're going to do their best to display real emotions and responses, and you should do the same. And that's kind of leads into this next bullet point of showing empathy. So like I said, a lot of these stations when you're in role play situations are breaking bad news or telling a patient about a challenging diagnosis or something that is just sometimes hard and awkward to deliver, especially if you've not done it frequently in your job or whatever it may be in your experiences. And so it's really just important that you can show empathy. And that doesn't always mean, it's saying I understand how you feel. Oftentimes you can't possibly understand how they feel, but just demonstrating that you are there for them, that they are certainly going through, acknowledge their fears or their concerns or whatever it may be, and just acknowledge and validate. And oftentimes that's a good form of empathy. Also active listening. So some of these role-playing stations will be the actor or the patient or whoever it is you're speaking with will be, conveying their serious concerns or fears or whatever it may be, or doubts or whatever it may be. And you should demonstrate that you're actively listening by sometimes speaking back to them. So I hear that you're concerned about, the ability to pay for this hospital bill or whatever it may be. And that can demonstrate that you're actually listening to the patient and not just thinking about the next thing that you want to say. And as in real life situations, you need to balance professionalism and warmth, or like, you know, how you relate to people. Rapport is kind of how I think about it. So you are in this situation, an expert in the field usually, and you are demonstrating that you are in this professional capacity, but also that you are a fellow human and you can understand that what they might be going through is intense emotionally or whatever it may be. And I think honestly, dealing with these emotions in this situation, one advice that I usually give to my clients is that it is okay to sit in silence for a period of time. They only usually give you 8 to 10 minutes for these stations, and it can feel awkward to just sit there. But if the patient is actively sobbing, or the actor is actively sobbing in front of you, sometimes it is best just to give them some time and some space and just to sit there with them in support. So if that feels appropriate, that is not definitely off the table. And I say that that would be okay sometimes too.
In terms of the collaborative problem solving, again, here you really want to demonstrate that you are a team player and that you can effectively communicate. And so what does that look like? It means being a leader without dominating the other individual. So facilitating discussion and encouraging input from others, from the get-go, tell the other person what you're going to be doing. And I always recommend that the students that work with me, you always ask what materials they have in front of them, what they're working with, so that can help you better communicate. Communicate clearly, so expressing your thoughts concisely, and then following up to make sure that your team understands what you're instructing or the suggestion you made, and being flexible and trying to think quickly on what are different ways to communicate things, whether it's describing something differently or using an analogy, etc. That'll help you be a stronger candidate during these MMI stations. Focus on the solution. So again, you have a common goal. You don't necessarily need to finish that. You don't need to have a perfect rendition of a knot or a photo or whatever team task you're building, but it's important to stay flexible and try to continue to drive the conversation forward versus getting stuck on some point that you're trying to get across. Be adaptable, be open to changing your approach depending on how your partner responds and what information they share, or if they're struggling to understand something. And always be grateful, show your respect, acknowledge the contributions from everyone on the team, and just being yourself in that environment and being thankful to your team will go a long way.
Yeah, I'll just add, sometimes they try and kind of trip you up by saying, what do you think didn't go well in that task? And it's important to it seems obvious, but just don't blame anyone. Sometimes it's just a failure of communication between people, and that's okay, but it's not anyone's fault that didn't go well. And certainly I would not say it's any other interviewee's fault. Next, talking a little bit more about these data interpretation stations. So these can be kind of intimidating because you want to make sure you're analyzing the information correctly. Sometimes I think this is helpful to really you really should take some breaths, stay calm, and do your best to kind of tune out where you are and just look at the data logically and systematically. Sometimes they give you paper and pen to take notes on, sometimes they don't. So that's just something you may need to work with or against, basically. But staying calm, reading through things, like good reading comprehension, and that just requires you to stay calm in this situation, which is kind of one of the things they're testing. Focusing on trends or patterns, so more like big picture. They will sometimes throw in a bunch of extraneous detail. Try to extract the big picture information and outcomes from these data interpretation scenarios. And then also, it is also okay if you perhaps don't get the big picture correct, or you don't perfectly analyze the data. What they really want to hear is your thought process and your understand of the parts that you do understand, and that you're able to communicate those components too, because that would relate to how you might be able to communicate similar situations to patients. And then be ready to make recommendations based on what you've read. So there will be some times where they will prompt the interviewer or patient or actor, whatever situation this may be in, where they prompt you to say, so what would you make of this, or would you recommend this drug, or whatever it may be. And so even though you've just read it and perhaps you're not totally confident in what you've read or how you've interpreted it, it's okay to just say, from what I've read, here's what I understand and what recommendations I would have. And then there's always, and sometimes this is on purpose and sometimes it's not on purpose, but there will always be perhaps incomplete data or some components that are not perfectly certain in the data that you're interpreting. And it's okay to acknowledge that you're missing something. In fact, sometimes that's the point, is to be like, this is some other information that I'd like to have. It helps us understand as interviewers, it helps us understand your thought process. And that is actually a moment where you can say, I'd like to have this additional information. Here's how I might go about finding that. And that kind of gives us a better idea about your inner workings of how you're thinking about things.
In terms of how you manage your time, so, again, each station is, even though you're given 8 to 10 minutes, it's really meant to also be a conversation between you and the interviewer. And so try to prioritize your key points quickly, identifying the main focus of each station to try to avoid wasting time. Is this an ethical question? Is it a teamwork? If they give you a paper, it's helpful to organize your thoughts in the 2 minutes you have before you enter each station. Avoid over-explaining, so try to stick to concise, clear answers. You don't need a lot of details that are unnecessary. You can really focus on, what you think the problem is, how you're approaching this situation, or really, directly answering the question from the beginning. Pace yourself, so make sure you allocate enough time for an analysis and response. You don't need to rush, but make sure you're aware of how much time is left and that you give the interviewer some time, because they might have some questions they want to follow up on with you. And then, of course, the MMI, the benefits is that while it can be stressful, each station is a new opportunity for you to really shine, show the admissions office who you are and why you would be a stellar student at their medical school. And so make sure to reset between stations and take a brief mental pause to stay fresh and focused. There's also usually some sort of break built in to the interview. So you might have a break MMI station too, where you can really use that time to reset, hydrate, etc.
Also, just a tidbit on handling unexpected scenarios. I would just expect this as an applicant that's attending an MMI. Like, when you're preparing for formal kind of one-on-one interviewer interviews, there are a certain number of questions you will get, and you can be prepared for those. I think MMI, while you can try and be prepared and look up some common scenarios, there will almost always be something that you were not expecting or you've never heard of before, and you're not totally sure how to manage. That is okay. That's actually part of it. They want to see how you think and handle yourself under pressure. And so really important that you stay calm. It's okay to take some time before you answer. Good question. Let me think about that is a perfectly reasonable way to start if you're not totally sure. And really, it's just keeping the main priorities of your MMI in mind, which is communication, problem solving, and empathy. So, and I would also add patient's best interest. Whenever you're confused and you don't know exactly where to go from this scenario or this question, keeping those things in mind will help guide you. And again, remembering that they're trying to understand how you think and how you logic through things and not necessarily what the right answer is, I think is always helpful, because it's reasonable to say, I'm not totally sure, but here's what my thought process is. And you get points for that basically from the interviewer. I mean, not literal points, but you get points for that from the interviewer. So that's important to keep in mind, even in situations where you've never heard of something or you don't know what the law says, or that's totally going to come up, and that's okay.
How do you demonstrate empathy in 8 to 10 minutes? It's certainly challenging, but something that's crucial for you to do during every station that you're at. And so it's really important to try to connect with others in an MMI interview. So what does that look like? There are going to be emotionally charged scenarios or difficult situations. And so it's making sure that you're listening actively, making eye contact with your patient, responding with compassion. And, to Catherine's point earlier, that can be what we call, doing some reflective listening and saying, it sounds like you're feeling X, Y, Z, or it sounds like this is really upsetting. You know, I hear that you're feeling exhausted, things like that, that can really help acknowledge the other person's feelings and show that you're listening and understanding their concerns. And you can always feel free to add to, you know, am I understanding you correctly? Is there something else you would add to really get more information from them? And of course, empathy doesn't always mean that you'll agree with everything. It's truly showing that you can appreciate and recognize their perspective and that you're respecting their time as they're sharing more information.
And as like any other interview, an MMI format interview is a great opportunity to demonstrate your skills and highlight yourself and kind of advertise yourself as an applicant. I think some ways you can do this, and these are certainly not an exhaustive list, but some ways you can do this is to relate to a scenario. So sometimes if you're in a scenario that perhaps you have been in before, say in one of your volunteering opportunities or a pre-med job, something like that, you can sometimes relate to that either verbally out loud. Oh, when I've seen this in the past, here's what I've seen and how it's been managed. And here's how I think that applies to the situation. Or you can just reflect on that and think, what have I seen before and how is it managed? And then also presenting with confidence. So sometimes you will just have kind of a one-on-one kind of straightforward interview station, and it's okay they'll ask you about your accomplishments. What things are you proud of? Again, in this format, but any format really, it's okay to emphasize strengths or accomplishments, but you want to do so in a humble way. I think this is actually a really important point. Nothing that you've accomplished, that anyone really has accomplished, has been done in a bubble. You've had help getting there, and it's always important to acknowledge that this didn't happen because you're just the smartest and best and hardest working, right? You had help along the way. I think that humility is a huge component of being a good medical student and doctor too. So they want to hear about that. And then in regards to skills that are relevant to your situation or future career, obviously you want to try and emphasize those as you would in any interview format.
It's important to stay focused and stay calm. And to add to Catherine's point earlier on as well, I think the hardest part of the MMI is probably relating it back to your personal experiences and any skills that you've had. And it's an area where I've seen students struggle. And I would say you don't need to force an experience if you don't have it. Don't make something up, be authentic. Again, it's really to show how you think, what your thought process is. But if you have some sort of experience with the subject for the MMI, whether it's personal, whether it's from a professional experience or volunteering or shadowing or research you've done, those are really helpful for you to share and kind of help explain the why behind your thought process and logic. And it makes it really easy for the interviewer to, one, understand your perspective, and two, remember you, because they're seeing a lot of students answer the same question. So you want to be memorable as well. In terms of staying focused and calm, there are mindfulness techniques you can do, deep breathing, especially when things get emotionally charged in some of the role-playing scenarios. It's okay to take a pause. It's okay to say, it's that, you need a minute to think about a difficult question or a follow-up that comes up. And I would say really focus on the task at hand and focus those 8 to 10 minutes on the situation that you're answering for the MMI station, rather than worrying about the overall outcome. You'll find that most students are poor judgers of how they actually perform at these stations. So really just try to focus on communicating well, being empathetic, putting the patient first.
Perfectly said. Great segue into this slide, which is really just to hit home the key traits that evaluators are looking for and the key traits that we've been harping on already, which is communication skills, or what I would say is like interpersonal skills, problem-solving abilities, and empathy and compassion. In regards to empathy and compassion, we've already talked about some ways you can develop rapport or demonstrate empathy with patients even in this short time frame, and that may be asking questions that are maybe not directly related to the answer you're trying to find, but really just relate to the patient. that's obviously critical to do in medicine or in any other professional capacity. Problem solving skills, this is like a teamwork. I would also include this in like communication kind of style, but really it's just they want to hear your thought process. And so try and work through each dilemma, whether you know the answer or if there is an answer or not, just work through each process logically and systematically and explain how and why you're thinking the way you are. And you get points for that basically from your evaluators. And then communication skills, this kind of links to all of the above. I think this works into your problem solving and your empathy and compassion showing, really just being able to clearly and concisely express your thoughts, concerns, views, empathy, all of those things. Maybe recommendations in regards to the data interpretation scenarios. So these are the key traits, and you want to try and keep these in mind when you're getting kind of lost about how am I doing in these interviews. Just try and emphasize these things, and I think you'll be doing well.
In addition, to really shine during your MMI interview, one, always be yourself. One of the things we look for when we're interviewing an applicant too is also, kind of a narrative consistency. Are you the same person that you presented in your primary application, in your personal statement, on your secondaries, that your letters of recommendation writers kind of highlighted? So it's really important to be yourself and be consistent with the application you've already submitted rather than to try to put on a different persona or to over rehearse. We really want to see who you are in this. Always stay positive. So maintaining a confident, optimistic attitude throughout the interview is important. And of course, you never want to kind of come off as a pessimist or kind of, present yourself in a bad way. So staying positive is very helpful. And that doesn't mean, staying positive mostly means maintaining a confident attitude. If you're in a challenging or emotionally charged situation that's a role play, it's okay to kind of be more calm. You don't need to be smiling through every MMI station necessarily. It's really kind of attuning your emotions to the scenario. And then lastly, again, each station is an opportunity to improve and do better. And so you don't have a lot of time in between, but, and I'd prioritize taking deep breaths, trying to keep yourself calm and confident. But if you do have a break station, for example, that tends to be longer, you can reflect on performances. So what you learned from each station, how can you adjust for the next station? What felt good to you? What you want to do better on? And I would say as a whole, the more interviews you do, the more practice you'll get. And you can do this for every interview that you go through, including the more standard traditional interviews as well.
Yeah, just to conclude, these are just kind of some final thoughts, which I'm sure we've already touched on most of them. But I think MMI format is generally a great format to just really get to know who the applicant is. It's a little hard to hide or perform when you're in a situation you've never been in before. So I think as an interviewer or evaluator, it's really helpful for me to see how does this person actually respond when someone is sobbing in front of them, because it's a little hard to fake that. So this is going to be great. If you've done any thoughts or processed or preparation for this, you're going to do great here. Just so be confident in your prep and your abilities. As Jason just mentioned, every station's a new opportunity. I won't go through that again, but just know that there's definitely been times where I had left an MMI station and I was like, okay, well, don't say that again. And that's fine. That's going to happen. So just be able to reset and move on to the next one. Stay composed and calm. These stations are often meant to kind of throw you off kilter and make you uncomfortable. That is the point, to see how you respond. So don't get shaken by that. Stay calm and composed and be yourself. And then if you are given any feedback, whether by evaluators or even just reflecting on your own performance, just take that in stride and kind of try and move on and do better in the next spot. And that's really what the game's about. So just wanted to say thanks for coming and letting us talk at you for 30 minutes or so. We're happy to take any questions about this or any other part of the application process.
Awesome. I think that's a perfect segue for me, just popping back into the conversation. I don't see any questions thus far, but I think I'd love to just give everyone a moment to, we threw a lot of information at them. So I think giving them a moment to let everything sink in would be the best. But in the meantime, I'd love to hear from both of you to see if there's any sort of information, anything you'd like to add that we may not have covered, whether that be about MMI, whether that be about the application process, or any sort of general words of encouragement or pieces of feedback you wish somebody had shared with you when you were going through the process.
I would say the best way to prepare for an MMI is to practice. And so whether it's through Inspira and working with a counselor like Katherine or myself, or going through your pre-health department at your university, seeing, if they offer mock interviews, or asking a friend to even, do some ethical situations with you, that's going to be the biggest opportunity. And one of the tips that I give, if you're doing this by yourself, you can record your responses on your laptop or video, watch it later, and see where you struggled with that question, what you want to improve. But really, it's practice, practice, practice. And there's so many questions out there. And I think what you're practicing is really sharing your thought process and trying to come up with mental models of, how you want to structure an argument, for example, whether it's pros and cons, or, because you're never gonna, there's so many different scenarios out there, and you will be surprised on your MMI interview day. And so prepare yourselves now, because there's going to be a question that will throw you off guard. And so you want to really build up the skills so that you can take that in stride and really answer questions with, again, the three things we have hammered over your head: showing that you can communicate effectively, showing your thought process, and that you can solve problems quickly on your feet, and of course, being empathetic and showing that you would make an empathetic doctor and listener, and are someone who has.
Yeah, I don't think I could say it better. That was perfect. I would just emphasize Jason's point of practicing these situations. I'll also say there's some great resources online that have like kind of ethics, medical ethics modules that you can Google and find, basically. But and those might be good to refresh. Like there are actually some, I remember like running into and having some clients run into too, like actual legal issues that you may need to have some background on. So I would recommend, in addition to everything Jason said, practicing, rehearsing, watching your responses, I would recommend reading a little bit of background into some very common medical ethical kind of scenarios, because there are like legal things you may need to reference or know about. And then I'll also just, one last tip was that we didn't really touch on, but I think is appropriate in some situations in these scenarios is, like I said, sometimes it's fine to say, that's a great question, let me think about that. But it's also fine to add to your answer, I'm not as well versed on this as I'd like to be, and I would definitely reach out to the medical ethics board at our hospital, things like that, where perhaps there's someone who's better suited to answer this question. Of course, you still have to answer the question, you still have to work through it, but it shows that you are comfortable reaching out to others that are maybe more experienced in the field than you. It shows humility, and it shows like your understanding of the system. So I think sometimes that's an appropriate answer.
Wonderful. Thank you to the both of you. I don't see any questions in the chat, so I think this is a great time to wrap up tonight's discussion. Katherine, Jason, thank you so much for being present. Thank you for this wonderful conversation. To our wonderful audience, if you have any questions, please feel free to either book a free consultation by scanning that QR code, or just get back to our email and we'll have one of our wonderful experts, someone from our team, really get you those questions. Within the follow-up, you will receive this recording, but we'll make sure to add in a few resources as well. We have a couple of tools on our website that I think are, one of them, for example, is common questions with some responses, and they're timed responses, which is really nice, and so on and so forth. So we'll make sure that we add that in there as a bonus for you guys joining us tonight. With that being said, thank you, everyone. I hope everyone has a wonderful evening, and we'll see you on the next webinar.
Thanks, everyone.
Bye everyone.
Have a good night.